For more of this, let's bring in now the Shadow Health Minister Anne Ruston. Senator, welcome. New Zealand says they've got no issues. The very mighty US Food and Drug Administration says there's no issues at all over there. There's a shortage of a particular size of the saline product, but across the board, no, they're fine. So how on earth has Australia got a so-called global problem that no one else has got?
Well, I mean, the really shocking thing about all this, Peter, is the fact that the government admitted last week that they actually knew that there was a potential shortage pending over a year ago, and clearly other places around the world have done whatever they needed to do to shore up supplies of IV saline so that they could support their healthcare systems in their countries. I mean, even as close as, New Zealand saying that there's no shortage. But, it was really pretty disingenuous of the minister last week to say this was a global shortage, and sort of as if to say that, the Albanese Labor government didn't need to take any responsibility for the fact that we find ourselves in this position is quite extraordinary. And I asked Katie Gallagher again today, what the situation was. And, she continued to obfuscate and just say it was somebody else's problem. It was a problem of the states and territories, and, that they were handling the situation really well. Well, I've got to say, Australians who are going into hospital and not being able to get saline drips. I heard today that there were patients in hospitals who've been told by their doctors to drink more water because they're not able to get a saline drip. That should not be happening in Australia. And I think Mr Butler and the Albanese government need to come out and explain to Australians how come this is happening here in Australia and it's not happening anywhere else in the world, despite the fact they've known for a year.
So we've got, as I mentioned, one domestic manufacturer. This is Baxter in Western Sydney. They supply basically all the saline fluids to New Zealand. They're in a good place. How on earth can we have a domestic manufacturer? We're in trouble, but New Zealand's not. And what's the government doing about it?
Well, one of the things that we did during the pandemic, we didn't have a year's notice, by the way. We had a few minutes' notice that we were potentially challenged about some of the supplies of these really important health products. We used a mechanism that was already in place, the National Medical Stockpile. So the federal government took a leadership role and negotiated to make sure that we had a stockpile of these really important medical products. What the Albanese government has done is they've just left the states and territories to do their own negotiations. Clearly, they haven't been done. And now we find that the supply in Australia has been depleted where it hasn't elsewhere in the world. I mean, obviously New Zealand, who are also supplied by Baxter out of Australia, have done their homework and they've worked out that they needed to make sure that they had their supply contracts in place. So I think it's incumbent on the Australian federal government to actually take a leadership role here. They were very quick to criticise the coalition government during the pandemic. So I think that maybe it's time for them to take a little bit of responsibility, because what's good for us is good for them. And I think that the Albanese government has really let down Australians, because you should not have a situation like we've got here. As I said, a year's notice is an awful lot of notice to fix up a problem.
How concerned are medicos? I mean, what are medicos saying to you?
They're very, very concerned. Because, I mean, despite the fact this is a very simple product, it is really nothing more than salt water, but obviously of an extraordinarily high quality. But, it is absolutely fundamental in just about every healthcare setting. So we're now going to see a situation where it'll only be able to be used and rationed out in emergency situations. It'll probably have major impacts on elective surgery because, of course, we are not going to be able to use saline in those sorts of situations. So I think, Mr Butler and the TGA need to get off their collective tails and get out there and do a little bit more. We found out last week that they'd set up a monitoring committee a week and a half ago. Over a year into this, their action, the first federal government action was setting up a monitoring committee. I think we're a bit past monitoring.